Hello, everyone. My name is Lanissa, and for this week's test assessment, I decided to do the Wechsler Intelligence Scale. It is one of the most commonly used assessments in school-age children. The ages range from 6 to 16. Each kit is designed for a specific age group. The scales can also be used to diagnose learning disorders, um, ADD, OCD, brain injury, and anxiety. The benefits to this assessment, if you're getting the kit, is increased construct coverage without increasing test time, identify and diagnose intellectual and learning disabilities, and also evaluates cognitive processing strengths and weaknesses, and it supports flexibility evaluation of specific learning disabilities and two major approaches to specific learning disability identification, pattern of strengths and weaknesses, and ability achievement discrepancy. There are 5 primary index scales. The first one is the verbal comprehension. It measures verbal reasoning and understanding, concept formation. The visual spatial index measures the child's nonverbal reasoning and concept formation, visual perception, and organization. Working memory index evaluates the child's ability to sustain auditory attention, concentrate, and fluid reasoning assesses the child's quantitative reasoning, classification, and spatial ability. And the processing speed estimates how quickly and accurately the child is able to process the information. We actually use this assessment where I work, which is at the University of Mississippi Medical Center. I work on the children's psych floor, and I was able to witness how the assessment is given to one of our 6-year-old children. An example of the visual spatial index, which is measuring the child's reasoning and concept formation, visual perception. He was given 2 to 4 blocks. One side was white, one side was red, and one side was half white and half red. And the first time she would put the blocks a certain way and ask him to copy what he sees with his blocks. And then she gave a picture of 2 to 4 blocks in a certain way and asked him to copy what he saw. An example, when it comes to the validity and reliability of the measuring, there's a motor free short form of the Wechsler Intelligence Scale, and it estimates use with motor impairments, and it was able, the information was reliable for the assessment of intellectual functioning in use with motor impairment. So it was able to measure what it was looking for, and it was reliable in order if it needs to test children who have motor impairments. And that is it.